The CATS Index of Independence in Activities of Daily Living, commonly referred to as the CATS ADL, is the most appropriate instrument to assess functional status as a measurement of the client's ability to perform activities of daily living independently. Clinicians typically use the tool to assess function and detect problems in performing activities of daily living and to plan care accordingly.
Age-related changes and health problems frequently show themselves as declines in the functional status of older adults. One of the best ways to evaluate the health status of older adults is through functional assessment, which provides objective data that may indicate future decline or improvements in health status, allowing the occupational therapist to plan and intervene appropriately.
The index ranks adequacy of performance in the 6 functions of bathing, dressing, toileting, transferring, continence, and feeding. The instrument is used effectively among older adults in the community and all care settings. The tool is most useful when baseline measurements are taken when the client is well and compared to the periodic or subsequent measures.
Clients are scored on a scale of 0 to 1. A score of 0 indicates the client is able to perform the task with supervision, direction, personal assistance, or total care. A score of 1 indicates the client is able to perform the task with no supervision, direction, or personal assistance. A score of 6 indicates full function. A score of 4 indicates moderate impairment, and a score of 2 or less indicates severe functional impairment. The Gutmann scale is an additional scoring method for the CATS ADL. When using this scoring method, you rate the client's functional independence from levels A to G. A score of A is given when the client is independent in all areas. A score of B is given when the client is independent in all but one area. A score of C is given when the client is independent in all but bathing and one additional function. And a score of D is given when the client is independent in all but bathing, dressing, and one additional function. A score of E is given when the client is independent in all but bathing, dressing, toileting, and one additional function. A score of F is given when the client is independent in all but bathing, dressing, toileting, transferring, and one additional function. A score of G is given when the client is dependent in all 6 functions. And a score of Other is used to score those dependent in at least 2 functions but not classifiable as C, D, E, or F. The Likert scale is an additional scoring method for the CATS ADL. This scoring method is on a scale of 0 to 3. A score of 0 is given when there is complete independence. A score of 1 is given when a device is needed. A score of 2 is given when human assistance is needed, and a score of 3 is given for complete dependence.
Now we will demonstrate the CATS ADL on our client, Reed. Hi, Reed. I'm Bailey. I'm an occupational therapy student, and today I'm going to be doing the CATS Index assessment on you. And this assessment is going to test your independence in activities of daily living. So today we're going to go through all of these activities such as bathing, dressing, toileting, transferring, continence, and feeding in your natural environment. So are you ready to get started? Okay, good. To be independent in bathing, Reed must bathe himself completely or only need help bathing one single part of his body, such as his back, genital area, or disabled extremity. If Reed needs help with bathing more than one part of his body, getting in or out of the tub or shower, or requires total bathing, he will be classified as dependent in bathing. Let's take a look. As seen in the video, Reed bathed himself completely and did not need help bathing any part of his body. This classifies him as independent for bathing, giving him a score of 1 for bathing. To be independent in dressing, Reed must get his clothes from his closet and put on clothes and outer garments complete with fasteners. He may have help tying his shoes. If Reed needs help with dressing himself or needs to be completely dressed, he will be classified as dependent in dressing. Let's take a look. As seen in the video, Reed got his clothes from the closet and drawers and put on his clothes and outer garments complete with fasteners. He did not need help tying his shoes. This classifies him as independent for dressing, giving him a complete score of 1 for dressing. To be independent in toileting, Reed must go to the toilet, get on and off, arrange his clothes, and clean his genital area without help. If Reed needs help transferring to the toilet, cleaning himself, or using a bedpan or commode, he will be classified as dependent in toileting. Let's take a look. As seen in the video, Reed got on and off the toilet independently. However, for his privacy, we did not video him arranging his clothes or cleaning his genital area, but he did so without help, classifying him as independent for toileting, giving him a score of 1 for toileting. To be independent in transferring, Reed must move in and out of his bed or chair unassisted. Mechanical transferring aids are acceptable. If Reed needs help moving from bed to chair or requires complete transfer, he will be classified as dependent in transferring. Let's take a look. As seen in the video, Reed moves in and out of his bed and his chair unassisted. No mechanical transferring aids were needed. This classifies him as independent for transferring, giving him a score of 1 for transferring. To be independent in continence, Reed must exercise complete self-control over urination and defecation. If Reed is partially or totally incontinent of bowel or bladder, he will be classified as dependent incontinence. Let's take a look. To respect Reed's privacy, we have decided to omit this section from the video. However, Reed scored a 1 and is independent incontinence. As stated in the video, for Reed's privacy, we did not video the area of continence. However, Reed did exercise complete self-control over urination and defecation. This classifies him as independent for continence, giving him a score of 1 for continence. To be independent in feeding, Reed must get his food from the plate into his mouth without help. Preparation of food may be done by another person. If Reed needs partial or total help with feeding or requires a parenteral feeding, he will be classified as dependent in feeding. Let's take a look. As seen in the video, Reed got the food from the plate into his mouth without help. He also prepared the food for himself. This classifies him as independent for feeding, giving him a score of 1 for feeding. After completing the cat's ADL, Reed's scores were added together for a total score of 6. This score indicates Reed is fully functioning or independent in all activities of daily living.
When administering the cat's ADL, some best practice guidelines should be followed. 1. Use the tool to detect problems in performing ADLs and to plan accordingly. 2. Ensure the safety of the client. 3. Move hazards away from the testing area. 4. Perform tasks in a normal environment if possible. 5. Be in close proximity with your client in case they lose their balance. And 6. Encourage caregivers or family not to cue or help the client in any way if they are present. While the CATS Index is useful across many disciplines with high validity, there are some limitations to consider. 1. Basic ADLs are addressed, but not higher-level ADLs or IADLs, which creates a ceiling effect. 2. Very little distinction between the level of assistance is given. The test only tells you if the client is independent or dependent. And 3. There is a debate over the hierarchy of ADLs that CATS created, with eating being the least difficult and bathing being the most difficult. For the CATS ADL, the role of the occupational therapist is to perform the evaluation, explain the directions clearly to the client, interpret and communicate the results with the patient, family, and/or caregivers, and to create an intervention plan based on the patient's goals and results of the CATS Index. For the CATS ADL, the role of the CODA is to assist with the intervention and follow the instructions given by the occupational therapist. Please note the CODA cannot perform the actual evaluation.